Hello friends, calling everybody with arthritis. We're going to talk. Arthritis is no fun at all, but don't you feel bad. It's a disease that often happens as we get older because our cartilage loses the ability to heal itself. And it's also called degenerative joint disease, and it's chronic. And your cartilage starts deteriorating in your joints. Osteoarthritis is the most common form of arthritis. It can affect your hands, your neck, your hips, your lower back, and your knees. Now, the most common drug therapies, and we're talking, pharmaceutical drugs, are NSAIDs, Enbrel, Humira, and there's corticosteroid injections, and some doctors give heavy-duty pain relievers like Vicodin. Now, that's overkill, in my opinion. There are natural solutions, and I'm here to tell you about them. Number one is SAMe, 200 milligrams per day. Studies, and you all know if you follow me, I love studies, evidence-based medicine, I'm your girl. Studies show SAMe can reduce pain, stiffness, and at the same time stimulate production of cartilage so you can halt and reverse the progression of arthritis. SAMe also reduces that morning stiffness and that pain that you feel even when you're at rest, that cracking and popping that happens in your joints, and your limited range of motion. So give SAMe a try. And give it a decent try. 3 months is the minimum. Don't give up the ghost until you've got done at least 3 months. Progesterone. Well, I'm the progesterone girl, but guess what? It's found to help arthritis. As you get close to perimenopause and menopause, and you get it, you can combine it with estrogen if you want to even try to do a little more advanced therapy. So progesterone alone or with estrogen, and you call me if you want to discuss this option. Number 3, glucosamine chondroitin. It's been around for a while. It's the old kid on the block. Why is that? Because studies show it works, especially for severe hip or knee arthritis. Okay, omega-3 fatty acids. Even the mainstream medical doctors are going to tell you it works. It can alleviate 80 to 90% of your pain. So please, give it a 3-month try. This supplement can help you, and there's so many other benefits. We've all been hearing about omega-3s. Depression is another, antidepressant activity is another one. But please, if you have arthritis, get your omega-3s. Vitamin D. Again, studies, 65% of osteoarthritic patients improved. I like 2,000 to 4,000 units a day. Vitamin B12 reduces pain and inflammation because it regulates the action of your immune cells. And one more little thing from God's Pharmacy, and all of these were from God's Pharmacy: eat more grapes. That's right. A study showed that this improved joint flexibility and mobility by 70% because grapes have resveratrol. And by the way, you know what you can do to make grapes really interesting? Put them in your freezer and take them out at night, and that's your snack. They're delish. And I just want to say, if you're currently on any arthritis medications, you can add any of these to your regimen. They won't interfere. On a personal note, this subject is very dear to me. First of all, I'm old enough to be getting arthritis, which I don't have it, but my dad suffered from severe arthritis, and he refused to take any of my advice. You know how parents can be. I'd say, Daddy, you can do this, you can do this, because he was always in pain, even on his heavy arthritic drugs. And he kept saying, well, my doctor says. Well, not all doctors are keeping up with recent studies on anything naturopathic. They go by what they were taught in medical school, which may have been 30 to 40 years ago. Think about it. Or by what the pharmaceutical reps are telling them. And of course, the pharmaceutical reps are talking about drugs. You can be smarter than your doctor. Happens all the time. Sometimes doesn't pay off to act that way when you're around them. You know how that could go. But just add some of these therapies and see how you do. You were not designed to suffer. And if you're my age and you're over 60 and you're in your menopause, or you're younger than me and you're approaching perimenopause and you have joint pain, inflammation, muscle tensions, right from our little book, Natural Progesterone for You, it's one of the 35 symptoms of hormone imbalance. So it may not be arthritis, and you can stop it with just one product. So if you're suffering from arthritis or from anything, I invite you to call me. I'm a research aficionado. I'll find out what will work for you. And I want you to call me or email, because I love my YouTube viewers.